Okay, so let's go ahead and get started. Good evening. In accordance with Government Code Section 551, I will now call this meeting of the School Health Advisory Committee to order at 4:33 p.m. And of course, I would like to thank each of you for being a part of this committee. I'm Dr. Karen Halachka, and I'll be the superintendent's designee who kind of helps facilitate these in partnership with you guys. We do have a very busy agenda this evening. We've got about 6 items on our agenda. You should have a copy of that in your spot with you. But we are going to start by just kind of welcoming everyone, having a little bit of a team building activity before we move into the important work of talking about what this committee is, what our role is, and then get digging into some of the operational parts of the district and some things of that nature. So thank you all so much for being here. I'm excited to have each of you as a part of this committee. So let's start quickly with team building. Again, just a reminder, we will pass around the microphone. And if you will, just tell everyone your name, what role you're serving on the committee, and why you agreed to serve on the committee. So we will start this direction.
Hello, my name is Shayla Pratt. I am the Director of Counseling for Duncanville ISD, and my reason for serving on the committee is just to ensure that the counseling department is in alignment with our mental health guidelines from the state and making sure we can we're doing all that we can to serve our students.
Hello, my name is Maylene Grant. I am the Director of Nursing for Duncanville ISD. My reason for serving on the committee is I am passionate about school health, and I want to make sure that we are in alignment with our health services is in alignment with what school health is about, making sure that our students are healthy and served by our health services.
Hi, I'm Gloria Lockhart. I'm representing the community. That's my committee role, I suppose. And I'm on the committee because I want to represent the community.
Good evening. My name is Letitia Griffin. I'm the Associate Principal of Operations at Duncanville High School. And the purpose of me serving on the community and why I chose to serve on the community is just the opportunity to continue to learn and to ensure alignment of health services as it relates to specifically the high school, and being proactive in the opportunities to be able to ensure this health and safety of our faculty, staff, and students.
Good evening. My name is Alex Hawkins. I'm the head athletic trainer, sports medicine director for Duncanville ISD. And my reason for serving on the committee is to ensure that I am ensuring our athletes with the best care, prevention, and health possible that we can provide, and to be more informed and to have an active role in the organization of our health here in Duncanville.
I'm Cheryl Westbrook. I'm a registered nurse, and I'm on one campus, but I've been on 2 campuses before, and I just want to be a part of making sure that the health and wellness of the students are kept in mind, and we provide for them whatever they need.
Thank you, everybody. My name is Rosemary Unweb. I'm a pharmacist, and I'm with Thompson and Albertsons Pharmacies. And my reason for serving on the committee, I was just invited to serve on the committee, is really to see what we can do in terms of being able to provide care for our students, also the faculty and staff, but really just being in the community and seeing what we can do as an organization to help protect and take care of our students.
Good afternoon, everyone. I'm Sarah Dickey Hill, and I'm a school counselor here. My role and reason for being on the committee is to hopefully be able to collaborate, align, and effectively communicate procedures, guidelines, and best practices for the students and their families on my campus.
Good afternoon. My name is Stephanie Reddick. I'm a nurse with the Dallas VA Medical Center, but I am serving in the capacity as a parent. I have a couple of little ones at Hyman Elementary, and I have a passion for nutrition and health, so that's why I'm here. Thank you.
Good evening. My name is Donna Woodard Thomas. I'm the Director of Nutrition Services in Duncanville ISD. And my main reason for serving is my arm got twisted and I no, I was voluntold. But anyway, really my main purpose is to ensure that all of our students receive palatable, well-nourished meals on the day-to-day basis. Thank you.
Introductions, I guess. My name is Chevelle Hampton, the Chief of Police for Duncanville ISD Police Department. And I'm here because I want to be a part. I was a member on the committee, I guess, before COVID. So I enjoyed it and just want to continue to be a part.
All right. So for those of you who may not have heard my introduction, I just want to let you know that due to new state laws and requirements, these meetings are now recorded. So we are being recorded, which is why we're speaking in the microphones. So our videos will be on the website, so just so everybody is aware. But it's perfectly fine. So knowing who everyone is a really important part of this. And so what you'll see is that we have a very diverse group here that represents not only employees within the district, but they also represent our communities, our families, because all perspectives are so important when we're talking about a comprehensive health and wellness support for our students and staff here in the district. And those are all topics we'll be discussing as we go throughout the year with our meetings. So as a team, it's really important that we work as an effective team on this committee. So what I'd like for us to do, we've already kind of gotten the practice of taking the microphone and going around, but what I'd like for everyone to do is to go around and share with us one thing that you feel, one quality you feel makes an effective team. And as you go around, I'm going to write them on our chart paper. One thing that makes an effective, one quality that makes an effective team.
One quality that makes an effective team would be communication.
I think a quality that makes an effective team is having good listeners. Listening.
I think it takes cooperation to have an effective team.
All right, and along the same lines, just collaboration, bringing in different ideas.
That was so my answer. So I guess you need to be fluid.
I would say decisive leadership.
I would say respect each other's opinions.
I would say transparency.
I would say empathy.
the ability to respectfully and be open-minded to constructive feedback.
Wait till she get kind of caught up there. I would say diversity in team members and thought process, which we have.
Thank you guys so much. So when you look at these qualities of an effective team, this is really what we will strive to be here on this committee. We really do want to be good listeners. We want to have effective communication. We want to respect each other's opinion. We want to have that empathy and support for various situations, but we also want to be able to be decisive and come to consensus on things that we are required to do. And so all of these are good, strong qualities that we want to try to emulate at every single meeting that we're at, because our role is extremely important in the district, because we are actually serving as advisors to our school board regarding the direction that we need our district to go as it relates to school health for our students and our staff. So thank you guys for sharing that. So let's go on to our next piece, and let's talk about our committee members. We are required, one of the things I've provided for you that's under your agenda for today are our bylaws for this committee. Now, there's been some recent changes to state law, so at some point during this year, we will be updating our bylaws, and so we will go through a process to revise some of these, but I wanted you to have the current ones. But what you'll see here is that we are supposed to have between 15 and 35 members on this committee. That is a diverse representation. We do have that many members officially. We've had some that were not able to be here today, but we do have about, I think it's 17 on our committee. So we do, however, need to select officers, because this is, even though I'm the superintendent's designee, this is your committee. It is something that you guys oversee, and I'm just here to help support and guide. So our officers serve 2-year terms, and so that means you're here for 2 years. And we have to have a chair, a vice chair, and a secretary. The back 2 pages, I think, of the bylaws talk about the roles of those officers. So you can see those. What we will do is I will be taking nominations this week. I put on there till 9:30, but you can, if I don't get them till Friday, that's fine too. But that's just an email of, I would like to nominate this person from our committee to be the chair, the vice chair, or the secretary. If you will submit nominations, then on Friday, I will send you an electronic ballot for you to vote on those positions based on the nominations. Okay? So if you will take a look at all our committee members, pick some out that you think would be good to serve in those roles, and please email me the nominations. You are able to self-nominate. So if you are interested in serving, you are welcome to nominate yourself as well. Any questions on that piece? Okay, so let's talk about what is SHAC. So our mission, the mission of SHAC, is that our whole role is we are a community-based council, and our purpose, of course, is to promote the health of students and the school community. So that's not just our students, but that's the whole school community. We are to be an advocate for comprehensive school health program. Our snacks today are not necessarily a great representation of that, but we are an advocate for comprehensive school health. And we are to serve in a health advisory capacity to the school board. So we advise the board on school health related matters. There are several policies, board policies that reference the role of school health. The main one here, of course, is BDF Legal, which says that the school board shall establish a local school health advisory council to assist the district in ensuring that local community values are reflected in the district's health education instruction. And we are to meet at least 4 times a year. So that gives you a little bit of an overview of why we exist. I did provide you a copy again of the committee bylaws. You can read through those, but it kind of talks about our role as a SHAC committee. So next, what do we do? So if that is our role, what do we do? Well, we have certain required discussion topics based on policy, things that we have to talk about as a committee this year. So first, we have to talk about our district wellness plan and what that includes, and so that is on one of our agendas. We have to talk about health education and our human sexuality instruction. And so I believe that's set for next month's agenda. We have to talk about mental health supports and character education, bullying prevention efforts and our drug alcohol prevention programs, as well as physical activity and coordinated health program, and our employee wellness program. So those are the 6 required topics. Now we will have some additional topics that are locally relevant, but those are the 6 required topics that we have to cover. I also have put a link to our website. We do have a website on the district's main website where we will post the videos of these meetings as well as our agendas. And I will share this presentation with you as well. So with that, before I move on to Mrs. Grant talking about our COVID-19 protocols, as well as giving you an update on our current numbers, are there any questions about the role of SHAC or your role on the committee? Okay, so Ms. Nurse Grant, I will pass the microphone to you and the remote control. Mm-hmm.
So I'm here to talk about the COVID-19 protocol for the school year. One of the things that we have been doing is we're recommending that everyone will wear their face covering. Anytime they're inside of a VISD building, face coverings are recommended. Our nurses are doing routine temperature checks, and so that's kind of done differently on the campus, but the temperature check may be that they're doing when the students first come in the morning. They may do them halfway mid through the day, and then there may also be another temperature check at the end of the day. We are making sure that social distancing is enforced, and that's where the students are recommended to distance at least 3 feet. And then our nurses have isolation rooms where the students who are ill with COVID-like symptoms, they're in the isolation room, they're waiting for their parents to pick them up. Even during the assemblies and when visitors are on our campuses, we're recommending and enforcing that the 3 feet social distancing be maintained. Each night, our facilities are e-use, so we're making sure that the classrooms are being cleaned, as well as each classroom have a handheld e-user, where most of the teachers are using them in between class time. Routine hand sanitizing, making sure throughout the building. So anywhere you go, you may see a hand dispenser, or you may see the hand sanitizer ready there to be used. Also disinfecting the materials and technology that's done at night or as frequently as it's needed to be done. Sometimes during the class change, you may be cleaning of the technology. And then our school buses are also being cleaned, and hand sanitizer is available on the school buses. So we're monitoring our symptoms. The daily screener that we had when we were doing last year is not done every day this year. So that's not required. That's a little different from last year. But the nurses, again, are monitoring symptoms, and not just the nurses. We include, it's a team effort to keep our students and staff safe. So teachers are also knowing what to refer the students to the clinic for. Unvaccinated students, they're sent home to quarantine for a minimum of 7 days. And so that's a little different from last school year. And then our negative students, when they have a negative COVID test result, they still are required to quarantine for 5 days, and then they can return to school, providing their COVID test is negative, or if a doctor gives them a note that says their condition is not related to COVID, and they don't have a fever, of course, for 24 hours without a fever-reducing medication, then they're allowed to come back to our campuses. When we have a COVID positive case on campus, the staff and the students get a notification through the email from their campus principal. The campus will contact tracing, and that's done, like, again, it's a team effort. It's not just the nurses contact tracing. It's done as a team. And again, once we hear about a positive case on the campus, we do additional sanitation at that time. So we've noticed that since the first week of school up until now, there has been a decline in our cases.
Nurse Kane, I think you missed a slide, so you might go back one more. There we go.
Sorry about that.
That's okay.
So our parents and staff notifications, individuals, students, and staff, they're notified if an exposure is on campus that there was a COVID-19 case. And then a general letter is sent out to our staff and students, to our staff and their parents if there's a positive case in the classroom. So we're also offering the rapid COVID testing for employees only at this time. They do have to sign up, and appointments are required. And most of the campuses are doing the COVID testing before school and after school. We also have asked our nurses, because we know the seriousness of having teachers tested when they need to be tested or when they're having symptoms. So we're also asking our nurses to be flexible, and sometime during the school day, they may end up providing a COVID test to an employee that needs one. So we're really trying to be proactive with our staff and trying to keep our staff safe as well as our students safe. Now our numbers, our COVID update, again, as I was saying, our numbers have declined somewhat since the beginning of the school year. And one thing that maybe has kept the decline is that we are recommending that our students come to school with their masks on. And if they don't have masks, we're providing them a mask. And we try to catch those students at the entrance before they actually come into the building. We're encouraging our parents to keep their students home if their child is sick or having COVID-like symptoms. So I think that has helped to see our numbers decline.
Yes, we are continuing to maintain a dashboard on our district website too, as transparency for our community, so that they know how many COVID cases we have at any given time. Like Nurse Grant said, we are continuing to see a decline. We are currently continuing our rapid COVID testing. We are considering continuing that with TA. TA has a program that will allow us to continue to do rapid testing and continue and consider partnering even with a vendor to where we could expand that even further beyond what our capacity is. And so, as a part of the discussion of this committee, what is y'all's, what would you say is your feeling regards to us continuing the rapid COVID testing for at least staff, if not considering moving it more towards even looking at for students? What are your thoughts?
I worked at a camp this past summer, and we did rapid testing for our students, and I'm so glad we did because we caught a lot of positive ones. So that's my question. Will we start doing it for our kids?
And that would depend on the grant, and if we decided to pursue the grant. What we know is with the current capacity of our nurses that we don't have the capacity to do that. We would have to consider a vendor partnership with that and the cost related to that, because there are some, we would get a grant, but then you have to use that grant towards that. So.
Pass the mic. Okay. First and foremost, I want to say kudos to our nursing staff and just their responsiveness and their ability to be able to respond quickly to the needs of our faculty and staff. I think it's critical that we maintain testing on campus for a couple of reasons. Right now, because we don't have the resources in place to be able to support teachers if they do come down with COVID or if they're waiting for a test through an external process. And so I've seen the results of them being able to comfortably go to the clinic, get tested, wait 15 minutes, and then get their results back. And just the peace of mind that it immediately sets over them so that they don't have to go home to their family, you know, knowing that they're ill. There's so many positives doing that. So if we do have the option of maintaining it to support the operational capacity of our building on a daily basis in our district, I think that's important that we continue.
I also think it's important to keep the testing that we have currently because we don't have the capacity for teachers to be out. We don't have the subs to fill in. And if they have to be out 2 days to test somewhere else or 3 days to get their results, then we don't have anybody to fill in. And so this really helps with maintaining our capacity as far as staff.
And I definitely agree with that, and it also will allow, especially with contact tracing, et cetera, having that done on site as soon as there's a suspected case to make sure that if there needs to be, I mean, they're meeting with, you know, a good number of students on a daily basis, so we definitely want them to be able to be tested right away as soon as they are feeling symptoms that they might have.
85% through intentional programs and efforts, which I know doesn't sound like us, but if you move over to the strategies, it's very much talks about creating an employee wellness program and making sure that we are addressing the social, emotional, and physical wellness needs of our staff members. So, under these two goals, there are six strategies here. I won't read all of those, but they do talk about SEL and making sure that we are creating a comprehensive SEL program, that we are ensuring that students are aware of the social, emotional, and wellness supports available to them. And that one was a very important one, as they felt like our students did not always know what was available to them to help them in situations of need. To make sure that our teachers and administrators are trained on restorative practices and are tracking implementation of those restorative approaches to student behavior. To create comprehensive framework to execute a peer-to-peer mentoring program. This kind of touches on some of those things of making sure we're providing that SEL support, the behavioral support, as well as those prevention efforts and helping kids to mentor one another. As well as creating diverse committees to address family engagement and social emotional barriers. So that's how are we getting families more involved in addressing the social emotional barriers to our students. And then again, that last one, creating a comprehensive employee social emotional and physical wellness program. And so those are all the strategies over the next 3 to 5 years, not tomorrow, but over the next 3 to 5 years that we will be working on and talking about here as a part of this committee. Are there any questions about our strategic direction and some of the work we have planned ahead of us? You already signed up, so you can't have that. I've got it in an email. You said yes. Okay, so with that, I'm going to turn it over to Ms. Donna Thomas, and she's going to talk about our child nutrition meals program.
First, Grant, could you just click it for me? Okay. Once again, I'm Donna, and I'm the director with Child Nutrition. And so I'm just going to do a brief overview of our department and the things that we have encountered over the last 18 months with COVID and moving forward, what our direction is. Okay, so last school year, at the end of the year, students were eligible to eat free. So regardless of their status, whether they were full pay, reduced, or free, all students ate free on last year. And so this year, USDA has once again given all states a waiver, and if the district chooses to, then the students can eat free. So that's one of the things that was decided, that all of our students will eat free again in our school district. Now, even though all kids are eating free, we still are encouraging our students to still complete the lunch applications for those that qualify, because there's so many other benefits for our families if they apply with the lunch program. And some of those benefits, I have listed those here. I don't know if some of you heard of the pandemic EBT. That's the electronic benefit transfer that students can receive. So a lot of our students, or most of our students, qualified for that benefit on last year. And they did receive monies in the form of the food stamp card. They received that per child. And then in addition to that, there is additional PEBT that will be covered for the summer based on per child, and the USDA has now said that there will be future PEBT for the fall, for this school year. So that is one reason why we are still accepting applications for our students, because we want them to receive those benefits whenever they become available. Because if USDA says that, you know, these funds will be available, then you have to go ahead and fill out the application, because there are deadlines that are deadlines that come about when you're applying for all these different time dates. And not only are these benefits, PEBT, the school district receives so many other funding programs based on our free and reduced eligibility. And each year, if a student applies for free or reduced meals, and then the next year when school starts, there's a 30-day carryover that a child will still be eligible for 30 days of free or reduced meals the first 30 days. Now, once that 30-day expires, then they would go back to, they will revert back to their original pay status if they have not reapplied. So that's why it's important for families to continue. You know, there's so many benefits. You know, we get discounts on technology. You know, schools receive additional funding because of our free and reduced participation in the high percentage. I've mentioned here with PEBT for 2021 school year, it's already ended. You know, most families, depending on how many children you had in your household, each child received $1,200. So that was a pretty significant amount of money for families for food. And so there were families that received, they had 5 kids. And so that's a lot of money for them to buy whatever they needed for their child, you know, from the grocery store. Now, the summer PEBT, that ended on, well, the cutoff for applying is, or it was August the 26th. So that just recently happened. And then we don't have a date of this school year's PEBT benefit. And USDA, they're hoping to get us more information in the upcoming weeks. So again, it's very important that although all meals are free, that our students and families continue to apply for the free and reduced meal applications. Now, because of all the things that are going on, every student is eating free, but I'm sure that you've heard on the news, we have a nationwide supply issue. And not only just with you know, spoons, forks, things that you just wouldn't think about, but you know, the supply chain is broken, and so that is causing us to make substitutions on our menu. So if there's chicken on our menu, it may not be a chicken nugget, or it may not be you know, a chicken tender, but it will be some type of chicken. So you know, I want parents and everybody to be aware that we have food. We'll always have food. USDA has given us, again, waivers nationwide because of all of the shortages. I mean, there are actually ships that have docked, and there's no one to take the food off, or no one to take, there's no drivers. You know, I'm on a task force with the state, and you know, our main vendor is Labatt. So Labatt, last week, they couldn't deliver our food on Monday because they had no one to bring it to us. So Tuesday, they sent the supervisor out. So you know, Cisco has hired 35 drivers because there's just not enough people that want to work. That, you know, I forgot I'm being recorded, but there's just not, there's just not enough people that are willing to do the different type of jobs that are available. And so again, I'm telling you this so you can kind of get an idea that although our menu may say one thing, the kids will get a meal. We have waivers to make all of those modifications because of the shortage in the supply chain. Okay, now this Friday we will actually have an early release day, and so our goal is to always feed our students. And so we felt that it was just in the best interest to feed students before they leave for the day. And so we have, principals have adjusted their meal times so that students will be able to just go through the line, pick up their meal. It'll be a grab and go, a burger, et cetera, with the sides. And then, they can take it on the bus. They can, they're going to eat it in the classroom, whatever they choose to do. But we felt that it would be important for them to get a meal because of the time that they are released. So that's one thing that we're doing Friday, and then we have another early release day, I believe, in February. Now, although students are eating free, we still are allowing them to purchase a la carte items. And so those items are like if they want a bag of chips, if they want, at the high school, if they want a Gatorade. Well, we haven't been able to get Gatorade, but once we get it, they can buy it. So, they do have, we have ice cream. All of our snacks, they have to meet federal regulations on the fat, the sugar. And so all of our menus they're the same way. That we can only serve menu items that meet the nutritional guidelines. We have a dietitian on staff, and she and we analyze the menus. We have to put every item and a la carte into a calculator so it would calculate correctly. If it has too much fat, we can't serve it. All of our ice creams meet all of the guidelines. So we do sell healthy snacks to our students. And that's basically all I have here. There's our main number. We have two coordinators. Virginia Morganfield is our elementary coordinator. Denise Alden handles our catering and our secondary campuses. We have one person in our office that processes lunch applications. And then we have our dietitian and our secretary. Are there any questions? I know there's always questions about food. No? So, yes, it's posted everywhere.
Have you been able to track
Well, I will tell you, this year, I have not seen that. Our students are eating everything we put before them. Currently, we're about 11,900 students, and we're feeding at least 8,500 for lunch every day. So they are eating. They are much aware of those meals being free.
I was on testing. So, Ms. Thomas, my question is regarding after-school feeding programs. Are we in the process or in the thought process of maybe coming back to that? In my area, you know, we have a lot of athletes, high school, middle school, and they don't eat. They believe that hot Cheetos is a well-balanced meal. And the issue that I have with that is when it's time to perform, when it's time for these athletes to perform, either in practice or game, they just don't have enough gas in the tank because they're choosing not to eat. Will those options come back either through school district provided or outside resources, or what are your thoughts on that?
Well, we've had a couple of vendors, and I really haven't had a chance to call them back. I received something at the end of last week in reference to providing meals in the afternoon after school. And so if we're not able to do that, I know at the elementary level we have Right at School, the Right at School program, and they provide those meals. Now, if there are snacks that are needed at our campuses, we provide those snacks. Now, pre-pandemic, we had met and we had started to discuss our staff actually providing the evening meal. But once all of the things occurred with COVID-19, we really put that on hold. And so, our goal is for us to start back looking at that. But one of the things that we have run into is staffing. Not having the sufficient staff to, it's hard for us to get the meals out for breakfast and lunch. And so then to look at staffing for the evening, that's one thing that we are, having to look very closely at because it's very hard for us to do that. But yes, I already started the research, and I think we had actually spoken with McDonald. I think we had spoken with Mr. McDonald about possibly providing the meals, or someone at the high school. I don't know if it was McDonald or not, but that's something that we wanted to do because, we get reimbursed for that. So it's not off the table at all.
So maybe we'll add that to a future agenda and get an update on that and see after they've had time to take a look at that.
Even if we don't do it every day, through the exploration of determining if that's an option, like we do have Thursday activities where we do have staff in the cafeteria on campus as far as to support supervising the scholars if that's a challenge. But we have cafeteria activities on Thursdays. So just keep that in mind if we want to explore maybe 1 or 2 days a week as a way to start to try to see if kids will actually use it and benefit from it. So just keeping that in mind. But that's available.
Great thinking, guys. Good stuff. Thank you again, Ms. Thomas. I appreciate you sharing and giving us that update. Okay, so let's talk legislative updates. As you know, we had a legislative session this spring, and then they had another special session, and they are now in special session 3, their third special session. So we may continue to get updates throughout the year. We'll see. But I did want to kind of start with just kind of giving you a little bit of an overview on a few of the bills that passed that will relate to us. So starting with HB 1525, this bill was actually a funding cleanup bill. ended up, they put all kinds of stuff in this bill. And so one being the School Health Advisory Committee. So as I shared with you at the beginning, our meetings now have to be posted 72 hours before. It has to be on the district website as well as posted at every single campus. So that is something that we are going to continue to work to make sure we're in alignment with. We do have to prepare and maintain minutes for our meeting. And again, make an audio or video recording and post that within 10 days on our website. And then there are some very defined procedures for reviewing and adopting a human sexuality curriculum. Here in Duncanville, we do not currently have a set defined curriculum for human sexuality. It's done through our health classes. And so that is something we will be talking about at our next meeting, about the process in regards to what it would look like for us to, those procedures, and how we would have to go about reviewing and adopting a human sexuality curriculum. So those were all the changes, legislative changes as it relates to the School Health Advisory Committee. So you guys got on right in time. So with that, there were several other bills that relate to health. First, there was a character ed bill. This was SB 123. And this bill adds self-management, interpersonal skills, and responsible decision-making to the state curriculum. And so as it is added to the state curriculum, then of course it is added to our local curriculum. And so that is one bill. Then you had SB 1109 related to violence prevention. And it requires the adding of child abuse, family violence, and dating violence prevention to the health curriculum at middle school and high school. So this will alter our curriculum for health at middle school and high school by adding those pieces. There was also SB 279, which was related to suicide prevention. And it requires that student IDs for grades 6 through 12 include content information for suicide prevention hotlines. So, this is something we're not currently in alignment with because the bill just passed, but it is something that we are going to have to look at getting in alignment with here soon. And then HB 3489 regarding digital safety. This again requires TEA, not us, TEA, to develop and distribute model health and safety guidelines for effective integration of digital devices. So once TEA develops and distributes those model health and safety guidelines, of course, those will then roll to the districts, and the districts will then be looking at how we do that. One thing that has not been necessarily a topic as part of the School Health Advisory Committee is that digital safety, and so that is something that I'm thinking we probably should consider adding at some point to the discussion of this group. And then HB 2287, this establishes a collaborative state task force for public school mental health services. And so anytime they create a task force, there are things that come out of that task force. And so we anticipate there will be some more requirements for mental health services. SB 179 regarding school counselors. This bill requires counselors to spend 80% of their time counseling. And if not feasible, a district must provide an explanation. Currently, our counselors do a lot more than counsel. They do a lot of things, and so this is one of those bills that we will have to work over time to come in alignment with. SB 1831 on child trafficking. It requires us to post at schools regarding the increased penalties for child trafficking. And so that has to be, notifications have to be posted at campuses. And then SB 776 regarding adaptive sports. And this is UIL. It has to develop an adaptive sports program at middle school and high school for disabled students. And so we anticipate that will come into the school districts as well at some point. And then HB 1080 on UIL exclusion. It basically says that UIL, we cannot exclude students from eligibility who have received outpatient mental health services. So if they are currently involved in an outpatient mental health program, they can't be excluded from UIL activities. So that's a lot of bills just related to health and wellness. So when you look at these, I put an asterisk by several of them. I think there's 5 of them I put up there with an asterisk that are more immediate. So when you look at those, how would you consider, how would you recommend the district prioritize those? What would you say is the most important thing that we should focus on first, making sure we are in alignment with those? Obviously, we have to get in alignment with all of them at some point, but where would you say we prioritize our focus?
Suicide prevention and violence prevention. It just seems like those are the 2 things I've seen since I've been within the district.
Okay, thank you.
I think to build a foundation, to be able to arm our scholars with the tools to make good decisions, character ed is critical. So but I know that's, I guess in my experience thinking, a lot of that usually starts at the elementary level and then builds through, you know. So just thinking about arming our kids with these tools to make good decisions, so character ed.
And I would most definitely say SB 179, because that's actually in the scope of what counselors do. We talk about violence. We talk about character education. We talk about prevention measures, anti-harassment, anti-victimization. Those are requirements. So if they're spending time in that zone, then we are addressing interpersonal skills. That is actually one of the core components of the counseling program.
That's something that's super urgent, and just dealing with our kids on a day-to-day basis and some of the tools that, and when they cry out for help, it's usually around and I'm specifically thinking about dating violence, especially as they get older, and just some of the cases that you deal with on a daily basis. So that would be my second.
To kind of piggyback on what Ms. Griffin was saying, the task force on mental health. Mental health will coincide with violence prevention and suicide prevention and all those different things. So I think mental health should be, paramount in everything as well.
So it sounds like we're saying counselors.
By process of elimination, it looks like definitely a continuous focus on making sure our counselors have the opportunity to counsel. Obviously, like I said, our goal, we have to get in alignment with all of them. But I think it's important that, I agree, I think it's important that we continue to work on making sure those critical employees, our counselors, are really doing that role, and they are counseling our kids because it's such a valuable, important part. And all of these other things kind of fall underneath that. If they can have routine conversations and lessons regarding all of these topics, then we're most likely going to address that. The one that I know Ms. Pratt and I have had several conversations about is the ID badges, and we've purposely kind of held off on that because there's some questions regarding, does that foster thoughts? And so we've kind of held off on that one a little bit. It is a state law, so eventually we will definitely have to comply. But what are some of your thoughts on that? I want them to have access to the information, but I also don't want to create thoughts that are unnecessary.
I'll just say really quickly, I know in our conversation, Dr. Halachka was mentioning that we would want to, as counselors, go in and provide a guidance lesson and not just give the ID and say, here you go, but provide some guidance around, what it means to have suicide ideation and the support that you have here on campus and the support, helping students to identify the support that they have in their community, at home, on campus, and just really going through all of those things and making it a teaching opportunity, and then providing them the ID card as an additional resource.
Thank you. Yes, I was going to say the same thing. I'm a psych nurse, so talking about suicide doesn't lead people to suicide. If someone's experiencing suicidal ideation, we would rather err on the side of caution, right, and let them get the resources that they need. But that is very important. Can I ask a question? So students can't participate in sports because they're receiving psychiatric care? Is that what that Uil Exclusion is saying, is that currently going on?
I'm not aware of that going on, but I think the law, I think the law was written to prevent that from going, if it happens. I'm not aware of that ever happening in Duncanville, but
yeah, right.
But
I just read it.
Typically, laws are written for something that's happened somewhere.
Right,
and
right.
so it wasn't here, but it could have been somewhere. And so as a result of that, it becomes a law.
Right,
That you
Thank
can't do that.
Thank you.
It's kind of like wearing your seatbelt. Somebody didn't, and now we all have to. So, yeah, absolutely. Great question, though. And I think that's a great perspective. I appreciate you sharing. Other thoughts on the legislative components?
I was going to add to the suicide prevention. That's important even to have at least a number on the back of their IDs, because from being a middle school nurse, there was many middle school students who was reaching out. If it wasn't for themselves, it was for a friend. And sometimes students don't always go to an adult, but they'll go to their friend and tell their friend. And then being a middle school student, you really don't know how to guide another student through that. But if you have a number that you can call, especially if you're not at school when your friend reach out to you via text, you may not be at school, so you may not be able to go to the counselor. But if you have your ID badge and you're able to see that number on your badge, then you have someone that you can reach out to for help.
Great discussion, guys. Thank you so much. All right. So with that, let's next time our tentative agenda, and of course our agendas are always subject to change based on topics that we discuss here or things, but tentative agenda is to discuss our wellness plan next time, as well as to look at, again, the process for the health education and human sexuality instruction, look at our mental health supports and character education, and then talk about bullying prevention efforts and drug alcohol prevention efforts. So that's the tentative agenda for November 1st. I do want to remind you just one more time from back at the beginning, if you are interested in serving as an officer on this committee, as chair, vice chair, or secretary, feel free to nominate yourself or nominate one of your fellow committee members, and that way we can make sure that you guys are the ones facilitating these meetings moving forward. So if you'll get that to me by Thursday or early Friday, that would be great. And look for a ballot to come into your email box soon. Are there any final questions or comments before we close out our meeting? Okay.
I just want you to clarify on the different positions that are held in SHAC. Those positions, are they supposed to be held by non-district employees, correct?
Yes, so if you go to page, let me get over there, on page 3, it doesn't say that it has to be non-district employees. It says it's preferred that no officer shall be an employee of the district, but by preferred, it doesn't mean it's a requirement. So it's just a preference, but, you know, we're just grateful that we were able. There's a little bit of a conflict on that because by policy, a majority of the committee is supposed to be employees. So you can't really, it's kind of a catch-22 on that. And so that's not, and as I stated, of course, at the beginning of the meeting, some of these bylaws we are probably going to need to revise. So I'm not necessarily, that's not a policy requirement in regards to the positions. Therefore, it is just a recommendation in our bylaws that we may need to look to adjust. But it is preferred but not required. So hopefully that helps. Great question, though. Thanks for clarifying. Any other questions? So with that, this meeting is now adjourned. The time is 5:41. Thank you all so much for being here.